The Cannabis Show is for information only. You should always consult with a qualified and licensed physician or other medical care provider.
Welcome to a special episode of The Cannabis Show. Today we are joined by Dr. Mark Kimmins and we'll be viewing the mini documentary Igniting Sparks. Coming up. Welcome back, Dr. Kimmins. For those of you who don't know, Dr. Mark Kimmins was on an earlier episode, episode 46, so make sure you go back and check out that episode. Dr. Kimmins, thank you for joining us on this special episode of The Cannabis Show. Before we get to the documentary, can you tell us how this medical industry has changed since we last saw you?
I sure can, and thanks so much for having me back, Chris. I was here 9 months ago, and since that time we've seen incredible rising demand for medical cannabis, not only here in Canada, but in the US. We now have 60% of US states with legal medical cannabis, soon to be 80%. So the tide has turned and we're not going back. And here in Canada, we've surpassed 300,000 active medical cannabis documents.
Yeah, that's astonishing. It's an exciting time for Canada. Well, what we're going to do now is we're going to look at the stories of two patients from Natural Health Services. Ladies and gentlemen, Igniting Sparks.
Natural Health Services opened its doors in 2015. People are pretty happy to realize that we are a self-referral clinic. We have several different doctors on staff. We have anything from psychologists to oncologists to pain specialists to anesthesiologists. Within 2 years of operation, we were in 4 provinces. We had 7 different locations. And really demand encouraged that growth. We were running at full capacity in pretty much all of our clinics. It was such a necessary model for health. So it was really a matter of fine-tuning and finding physicians who were in line with our compassionate care model and our harm reduction model that would basically fulfill what we tried to do all across Canada.
The use of medical cannabis by human beings has been going on for thousands of years. And it's only recently that we went through about an 80-year period of prohibition. And the use of cannabis as a medicine is really just starting to re-emerge. The benefit of cannabis as a therapeutic medicine had been buried because of reasons of political prohibition. I mean, it wasn't that many decades ago that we had movies like Reefer Madness that portrayed what was then known as marijuana as a craze-inducing, psychotic-producing, madness drug. And I think there's more and more appreciation, both at a medical level and a societal level, that we're dealing with a plant that has never killed anyone as far as we know. There have been no verified cannabis overdose deaths, and that is a remarkable statement. So a plant that's never killed anyone, and a plant which appears to have benefit in multiple medical conditions, and this is increasingly being backed up by scientific evidence. So I think with all of that put together, we're going to see more and more doctors being willing to acknowledge and accept this as a legitimate medicine.
My name is Amber, and when my now 9-year-old son, Luca, was 4, he was diagnosed with a highly aggressive form of brain cancer called anaplastic medulloblastoma. And they had warned us right away, treatment is going to be very aggressive, very long, and there's going to be many long-term consequences if we have any chance of beating this. So we spent 9 months in hospital the first year. We did those rounds of chemo. They were very hard. He was very sick. He would throw up for hours every single day. But he was too sick to get out of bed. He couldn't function. He was starting to have seizures. It was different. He wasn't himself anymore. And it's your 6-year-old, like, you have to try. So treatment was a high dose of radiation to his entire brain and spinal cord 5 days a week. And radiation made him incredibly sick. right away. His behavior became very erratic, violent at times, and we were starting to see significant and severe depression. And the focus had to become a lot about his quality of life. I wanted him to be accepting of what was happening. At that point, a lot of people had obviously come to us and said, you know, what about medical cannabis? And at that point in Canada, there wasn't any access. And the big issue at that point was, how do we acquire it safely for our children? Because as much as you want to try it, you need to know where it's coming from. We were using THC for pain management, even though he was very young, but we were also using morphine. So we thought, you know, let's try the THC and see what happens. And it worked incredibly well. And very quickly, within about a week, he started feeling better. At one appointment, the doctor had said, like, I would expect him to be doing much worse this week, but he's doing better than he was last week. And then eventually a clinic opened in Calgary, and we became patients very early on. We met with a physician who, thankfully, she was amazing. Like, we went through all of his medications, all of his treatment. She even wanted to talk to me about how I was doing. And with cannabis, he could get through his day, and he would want to get through his day. And that was a bigger part of it. Not just getting through, but wanting to get through it. One of the most amazing parts of cannabis is quality of life. Patients deserve quality of life. No matter what their disease is, they're not that disease. They deserve to have quality of life while they fight it.
The thing about cannabis versus a pharmacological drug is that cannabis is systemic. It works with our endocannabinoid system, which is the largest transmitter system in our bodies, found in our organs, found in our brain, found in our tissues, in our immune system, throughout our bodies, and that's why it works for so many different things. It can rebalance a myriad of different ailments within the body, and it will basically regulate your sleep cycles. It will regulate your stress response. So anything around PTSD or anxiety, it can help with. Although not a guaranteed approach, because everybody is bio-individual and different, but there are no deaths. It's a non-toxic substance. So the side effects are very minimal, especially when you compare them to other drugs. They're not harming your kidneys, your liver, your GI tract, and they're balancing everything when they go in to fix the one thing that's ailing you.
And one of the things I would like to help accomplish is to help educate physicians that we do have a lot of evidence and are steadily gaining more and more good quality evidence every day, which hopefully will allow these physicians to feel more comfortable in at least recommending medical cannabis to the appropriate patients.
Braden was born with early childhood onset epilepsy. Braden tried every single seizure medication there was out there. He had multiple surgeries, spent his first 3 years actually pretty much solid in the hospital. It was a nightmare for him, nightmare for us. Nothing was working for him. He was taking upwards of 40 pills a day. We were losing Braden, and as parents, there was nothing left for us to do for him. He was so depressed. Looking at him, there was nothing in there. He was not well at all. So in August of 2015, I had met with a couple different families who had children with epilepsies on medical cannabis, and we didn't really even hesitate. Braden was one of the first pediatric patients with Natural Health Services. Within 42 minutes of his first dose of cannabis, he had stopped in the middle of a seizure. He ate his first cheeseburger that evening. He was happy, he was laughing, he had color in his face. He came off of all of his epilepsy drugs. He's doing better off of them than he ever was on them. It really felt like we had to learn who Braden was, because for so many years we had a very fragile child. It was hard to picture his future, and it was really hard. Since Cannabis, we talk about Braden getting married, talk about how many kids he's gonna have, and all the fun things he's gonna do. I felt like his whole life I was his nurse, I was his doctor, and it wasn't until Cannabis where I finally got to feel like Braden's mom.
Natural Health Services is extremely supportive throughout the whole patient process, not just up to the point where the doctor hands you your authorization, but after the fact too. We have follow-ups every 3 months to make sure that the patient is clear on exactly what effects they should be looking for and any effects that they might not want. They might want to talk about changing their ingestion method, changing their dose, changing their licensed producers. All of that can happen at the 3-month checkup. By no means do we ever want anybody to feel like they're confused or they don't know exactly how to handle it, because it is an exploration, and we just definitely want to make sure that they're comfortable with that exploration. To request an appointment, and it can be self-referral if you choose, or you can talk to your doctor, just go to our website, naturalhealthservices.ca.
Welcome back. We hope you enjoyed the movie. Now, Dr. Kimmins, why do you think sharing stories like the ones that we saw in Igniting Sparks is so important?
Well, I think these stories are so important because they highlight what medical cannabis truly is: a legitimate medicine with the power to relieve symptoms and improve quality of life.
Now, why is it that doctors are staying away from, like, treating pediatrics?
Well, that's a somewhat complex question, because clearly these stories illustrate the power of cannabis medicine in the pediatric patient population, and there's thousands of stories across North America which also highlight this. However, pediatric medicine is a very traditional medical specialty, and in pediatrics, safety is always emphasized. And so with medicines in pediatrics, usually the doses have to be very precise and specific on a milligram per kilogram allotment. And in cannabis medicine, we don't yet have that data. So for a lot of people specializing in pediatric medicine, they're not quite ready to move there yet.
You know, I mean, if you can get a message out there to doctors, what would it be with medical cannabis?
The message I would want to give to Canadian doctors, I would paraphrase the father of Canadian medicine, Sir William Osler, and say, listen to your patients. Listen to your patients who are telling you that this is a powerful medicine that is helping them and their families. Listen to your patients who are telling you that medical cannabis is about harm reduction. Listen to your patients who are telling you it's about relief of symptoms without impairment. And listen to your patients who are telling you it's about quality of life.
By listening to the patients and stuff, is that how we can get, like, more doctors on side?
Absolutely, by listening to the patients and by education and research efforts. And I think we will inevitably slowly move forward to a time when it's hard to think back to when cannabis wasn't regarded as a legitimate medicine.
Dr. Kimmins, it's always a pleasure. Every time you come in, I just feel so much better about the medical cannabis industry. And yeah, that was a very powerful movie. And thank you for watching as well.
Thanks so much, Chris. My pleasure.